Osteoporosis is one of the most common health issues among the elderly, particularly postmenopausal women. It is not merely a condition of reduced bone density but also poses a hidden risk of fractures, significantly affecting mobility and quality of life. While modern medicine has made significant advances in treating OP, some patients struggle with tolerating Western medications or have to discontinue treatment due to side effects. This has encouraged researchers in traditional medicine to seek natural solutions that are both safe and effective.
Osteoporosis is often oversimplified as calcium deficiency, but in reality, its causes are much more complex. Two main factors determine bone strength. 1. Genetics, accounting for about 75% of the ability to maintain bone density. This factor is related to gender, ethnicity, and genetic structure. 2. Environment and lifestyle, making up the remaining 25%. This includes diet, physical activity, and habits such as smoking, alcohol consumption, or lack of sleep. Two critical hormones, estrogen and testosterone, play a major role in maintaining bone density. During perimenopause and menopause, the decline in estrogen levels in women increases the risk of osteoporosis. Similarly, men in their middle age face a higher risk due to declining testosterone levels. An important note is that after reaching adulthood, calcium supplementation is no longer the determining factor. Instead, collagen, the organic component forming the bone glue, is what needs attention. Specifically, type 1 collagen constitutes a large proportion of bone structure and contributes to both bone strength and flexibility.
Traditional medicine, with its philosophy of balancing yin and yang and addressing the root cause of ailments, has provided several effective treatments for osteoporosis. Below are some notable herbal remedies and formulas.
1. Chibosium barometz, also known as monkey hair or golden cat's claw. Chibosium barometz is a valuable herb in TM. Research shows that this medicinal plant reduces pain in musculoskeletal disorders, increases bone density, and shortens bone healing time. The recommended dosage is 10 to 15 grams per day orally.
2. Drineria fortune, known by other names such as stone gecko or dragon nest. Drineria fortune is widely used to support osteoporosis treatment. This herb enhances bone density and durability while improving motor function. The typical dosage is 15 to 20 grams per day.
3. Luke V formula. This ancient formula consists of 6 ingredients: Rehmannia glutinosa, Dioscorea opposita, Cornus officinalis, Paeonia suffruticosa, Olisma orientale, and Poria coccus. Shu D makes up the largest proportion, 32 g, while the others range from 12 to 16 g. Luke V has been used for thousands of years to treat musculoskeletal disorders and has proven effective in numerous animal and human studies.
4. Crocodile bone extract. A recent standout product is WA-CA crocodile bone extract, which contains a high concentration of hydrolyzed collagen that is easily absorbed through the digestive system. Preclinical and clinical studies have confirmed the safety, efficacy, and good tolerability of this product. Many patients who used it continuously for over 6 months reported significant improvements in bone density, reduced muscle and joint pain, and restored mobility.
To achieve optimal results, osteoporosis treatment should combine both pharmacological and non-pharmacological approaches.
Medication. Drugs that inhibit osteoclasts, hormone replacement therapies, such as estrogen, and drugs that stimulate osteoblasts. Supplementation with vitamin D and essential minerals.
Non-pharmacological therapies. A nutrient-rich diet, limiting stimulants. Regular exercise, especially strength training and balance-improving activities. Adequate sleep and stress management.
Osteoporosis is a chronic condition requiring long-term treatment, potentially lasting many years depending on the severity of the disease. Early and consistent treatment can minimize the risk of fractures and improve patients' quality of life. Traditional medicine, rooted in nature, not only offers effective treatments but also ensures safety and good tolerability. The combination of modern and traditional medicine holds great promise for advancing bone and joint health care for the elderly.
Don't forget to subscribe for more daily wellness tips.